when I found this 2-ton predator. He was bleeding out in the mud. But performing emergency field surgery on a prehistoric reptile inside a makeshift garage clinic? It's a logistical nightmare. The anesthesia protocol alone for a creature of this size is incredibly unpredictable. If he wakes up while my hands are still inside his wound cavity, I don't just lose a patient, I lose my life. This is how I ended up with a Baryonyx on my operating table.
I was tracking some massive, irregular footprints near the riverbank. Baryonyx are semi-aquatic theropods, so finding him near the water made sense. But his gait was completely off. He was dragging his right forelimb. When I finally caught up to him, he wasn't hunting. He had collapsed. I approached slowly, keeping downwind, and that's when I saw the catastrophic trauma to his manus. His signature first digit, the massive curved claw he relies on to hook massive fish out of the water, was completely shattered. We were looking at a severe avulsion fracture of the ungual phalanx. The surrounding tissue was swollen and hot to the touch. A massive pocket of purulent exudate had formed. The infection was deep. Without an immediate aggressive intervention, the septicemia would reach his heart within 48 hours. I had to secure him and get him to the clinic, now.
Transporting an 1,800-kilogram apex predator required industrial crane straps and a reinforced flatbed. Once we had him secured in the isolation bay, the real nightmare began. Induction. Reptilian metabolism is incredibly complex. A miscalculation in the anesthesia protocol doesn't just put him to sleep, it stops his heart. I had to establish intravenous access. Finding a viable vein on a dehydrated theropod covered in thick osteoderms took 20 agonizing minutes. I finally placed a heavy-gauge catheter in the ventral tail vein.
I pushed a massive, carefully calculated bolus of metatomidine and ketamine. As his heavy eyelids finally closed, the next hurdle appeared. Reptiles under deep anesthesia lose their respiratory drive. They literally stop breathing. I had to intubate him, forcing a custom-made 3-inch endotracheal tube down the throat of a dinosaur, past rows of serrated teeth that could shear through a steel pipe, is something they don't teach you in any textbook. I connected him to the mechanical ventilator, heart rate dropping to a stable 22 beats per minute. Time to scrub in. I applied a heavy pneumatic tourniquet to his upper forelimb to control the hemorrhage. The surgical field was a mess. The infection had compromised the soft tissue all the way down to the periosteum. I started the debridement, carefully excising the necrotic flesh with a scalpel. But the worst part was the bone itself. The avulsed claw fragment was jagged, destroying the surrounding muscle matrix. I had to use an oscillating surgical saw to perform a partial osteotomy, smoothing the bone edge so it wouldn't puncture the skin from the inside out once closed. The smell of infected reptilian tissue and bone dust was overwhelming. Then, the ventilator alarm screamed. His capillary refill time plummeted. The EKG monitor spiked. He was going into tachycardia. The anesthesia plane was getting too light. His massive jaws twitched, and his tail slammed into the surgical tray, sending instruments flying across the room. If he woke up now, the tourniquet would burst, and he'd bleed out if he didn't kill me first. I lunged for the IV line and pushed an emergency bolus of propofol directly into his system. Come on, come on. His heart rate stabilized. The twitching stopped. I flushed the wound cavity with 5 liters of sterile saline and began the closure. I used thick, non-absorbable synthetic wire in a horizontal mattress pattern. The tension on those sutures was massive, but it held.
The reversal agents were administered. Extubating a recovering predator is the most dangerous phase. It's called emergence dysphoria. They wake up confused, blind with panic, and ready to fight. I retreated behind the reinforced steel barrier and waited. He slowly pushed himself off the floor. His massive frame swayed. He looked at his bandaged forelimb. Then his eyes locked onto me through the steel bars. He let out a low, guttural rumble that shook the concrete floor. I slid 30 pounds of fresh, whole salmon through the feeding slot. He snapped them up instantly. The hunger was returning. That meant the pain was receding. We had an understanding.
He survived the night, and his vitals are completely stable. This is just the beginning. I now have a recovering, hyper-carnivorous apex predator living in my medical bay, and he's gonna need a lot of space and a massive aquatic enclosure to rehabilitate that arm. In the next video, we are transforming my backyard into a high-security prehistoric sanctuary. You do not want to miss this build. Hit that subscribe button, and I'll see you next time.